Nigudam Aushadya Rupam Dhanvantaram Cha Satatam Pranamami Nityam. A warm good evening to one and all. This is Swati Priya V from Dharma Ayurveda Medical College, Sri Permatur. It gives me an immense pleasure to host today's Ayurveda Zixa learning series conducted by I Ask Ayush. Streaming partner Vaidyagrama Healing Village, sponsored by Sanjeevi Ayurveda Hospital and Research Center. In this wonderful evening, I would like to invite Dr. Chitra R, ma'am, a proud speaker of today's session. Ma'am has finished her Ayurveda graduation from Venkatamana Ayurveda College, affiliated to TN Medical University, Tamil Nadu. She has started her career in Ayurveda as a lecturer in an Ayurveda medical college and coursed through various fields of Ayurveda medical industry like quality analysis of Ayurvedic proprietary medicines, product designing, and marketing, handling IP and OP in Ayurveda hospital within India and Malaysia. Her journey of founding and managing Darshan Ayurveda Center started around 10 years back after getting married to an agriculturist, educationist, and a nature lover, Mr. R. Gunasekharan at Karur. Both of them then started to fulfill their vision and dream of creating a cultural and healing living space at their farm at Mayanur. Her experience for the past 20 years has helped her to understand the depth of knowledge in this incredible science. She is an incredible health maintainer and wellness advisor. On behalf of everyone from I Ask Ayush, I Swati Priya wholeheartedly welcome you to today's session, ma'am.
Thank you. Am I audible?
Yes, ma'am, you're audible.
Thank you. Yes.
Ritukala is the most important phase of cycle since it is the fertile phase of the menstrual cycle. To educate us more about this, Rutumati Charya and its relevance, I request Dr. Chitra ma'am to proceed.
Thank you. Can I have the presentation slide?
Yes, ma'am.
Is the slide visible? Yeah,
No, it's not. It's
not yet
loading,
visible.
ma'am. It's not.
Yeah, okay. Okay, till then I'll do my introduction. Thank you for the lovely introduction, Susayeb. I'm so happy to be part of this team again, which is trying to increase the awareness of the Ayurvedic science throughout the normal people. And I have been watching many of the sessions, and I can, even as a lay person, it sounds very nice to get more information and knowledge about this, because everybody knows that this science cannot be completed. You cannot learn this completely in one lifetime. It has so much depth of knowledge. I chose this topic because I have seen that the female population in today's world, we have reached great heights, and we are advancing in our career and in our personal lives. But we are also facing a lot of drawbacks in our physical conditions, but we are not in a situation to handle it without the support of others. So this session is not only to attend the issues, and not only to say, I want to sensitize the family and the peers of female workers towards this problem and why this has to be taken into a serious consideration. Let us think of a basic staring issue we are facing now, the fertility issues. Fertility issues have increased from when the population had to be contained in India, because women were giving birth in huge numbers. And we had to use many methodologies to restrict childbirth. But in the span of 20, 25 years, say even 30 years, we have seen a complete turnaround in the scenario that now we are forced to take measures so that every couple has at least one good child. That is a very serious situation for 30 years, because the fertility is not restricted only to women, it is spreading to men also. So we will talk about that in another session whenever the time permits. But now we are restricting, or we will contain ourselves to the female issues. The lifestyle, what we have started to adapt in these days, is one of the main reasons. Many things about Ayurveda that has fascinated me, and the first and foremost is the description about lifestyle. We have always, as lay people or as practitioners or anybody who's in the medical science, we have always seen that medical, any condition which you face, any problem which you face, it is not cured only by medicines alone. When you take medicines, it may help you in the relieving of the symptoms. But unless you are able to identify why the condition has come, we have not been able to come to a conclusion on that. So we have not been able to curtail the progress of the disease or avoid the re-emergence of that disease. Thinking on those terms, let us think about, so that is why I always insist on patients that the treatment is four-phase: Aharam, Viharam, Aushadam, Chikitsa. Basically, in today's life, Aharam is what we have gone wrong in many, many dimensions. So, unless we are able to understand which kind of food is good for us and which kind of food is not suitable for us, we will not be able to restrict the oncome of diseases. The next one is the viharam, which is the lifestyle and the situation around us, the environment around us. We must be able to, at least we must be committed to modify or moderate certain things which will help in the reduction of any diseased condition. The third one will be the medical intervention with medicines, and the fourth step will be certain procedures and treatments which will help in the alleviation of a condition. So this is how I tend to step by step decide the treatment of a particular problem. So now considering this fact of menstrual issues, Rutumati Charya. See, the word itself is so beautifully designed that Rutumati, season. So what is a season for a human being? We think every human being is the same. Human being is a human being. But imagine different phases of life. Can you go to the next slide, Ma? Yeah, this is just a glimpse of our hospital at Karu. One more slide, and then we can go to the next slide. Yeah. Yes. So Ayurveda has always told that the speciality of Ayurveda lies in swasthasya swasthya rakshanam. So this nowadays it is becoming very popular in saying this phrase that okay, we can term it in layman's terms as prevention is better than cure. But how do we know how to prevent certain conditions? That is why the description of lifestyle in Ayurveda is going to help us to understand. Okay. Then in regarding that, okay, the first doubt, first block any common person will have is that, okay, how can you go back 50 years and start living a lifestyle that was working that time? True. We need not go back to that because we have been adopted and addicted to many modern facilities. We did not go back there. But first, are we aware of what wrong we are doing? Unless you are aware of what is happening within you and around you, you will not be able to change or modify that things according to today's situation. That is also another speciality of Ayurveda which I have seen is that it is adaptable and relevant to every modern time, every time frame. So we have to understand why that has been told and see what can be adapted this time. We will go to those points next. So swasthasya swasthya rakshana. Whoever is healthy, we have to maintain the health of that person first. That's a very, very deep rooted statement because health, again, going to the definition of health, it is not restricted to physical health alone. And now we have all understood that mental health is equally important to maintain a balanced lifestyle where though we have every wealth and every technology and all our needs fulfilled, but psychologically, if we have a drawback, we will not be able to be happy. So Indriyam and Manam, the sense organs, and the Manas and Atma also have to be happy and satisfied to lead a healthy life. So this balance, this energy balance between the mind and body, very recently today's world has started to understand, but it has been explained deeply in the Ayurvedic sciences long back. Coming to the point of fertility issues, Why is a woman's life so different from what it was 30 years or 40 years back? We had mostly, let us think about only the situation in India, because that is where we have seen a very broad change and a sudden change in the lifestyle of a woman. We have many viewpoints on this, saying that okay, women had to come out, women had to get study, and then women had to earn, and they had to be independent financially. Absolutely, I agree. Women have to be independent, but education should be increasing the knowledge and awareness of people. It should not be giving you problems so that we start hating the knowledge we have gained. So the knowledge doesn't restrict yourself to any subject you have pertained yourself to. First, the awareness has to be within the your own system. Swadhyayam. That is one point. Everybody, now we talk so much about yoga. Good. Yoga is correct. Yoga is definitely needed for Swasthya Swasthya Rakshanam. What does yoga say? Ashtanga Yogam. All of us are learning about that. What are the 8 steps of yoga to attain mukti? Yamam, Niyamam, Asanam, Pranayamam, Pratyaharam, Dharanam, Dhyanam, Samadhi. Samadhi is the one very higher conscious state. But the beginning stage, do we ever think about it? We all straight away go to a asana phase where we practice hatha yoga. But Yamam and Niyamam are the first 2 phases where we have to start following the do's and don'ts of your life. Only then, and your mind and body are healthy enough to start going into the Hatha Yoga phase. We think Hatha Yoga is another form of good exercise. It is true, but unless you are able to you are able to be committed to do the do's and don'ts of your life, you will not be able to go beyond Hatha Yoga into Pranayamam or Pratyaharam or Dharanam, Dhyanam or Samadhi. Okay, I'm not interested, let me do only hatha yoga, I don't mind, good, but you will not be able to reach the extreme satisfaction of doing all the asanas. Say for example, what are the yamam and niyamam? Do's and don'ts, simple aspects of your life, where you have to eat properly, sleep properly, be happy. Don't see, there are very interesting facts mentioned there, where there are, you should not Ichha, Dvesham, Sukham, Dukkam, all this are mentioned in Yamas also, where you will not go into extreme emotions. So extreme emotions and negative emotions will affect your manas. Though it affects your manas, automatically the increase of vata happens and your body also faces the same issue. Then you will not be able to do the postures as required. So you can correlate all these aspects mentioned in the text to today's relevance. So start following them in smaller circles, and slowly you can expand yourself, because that leaves a very good swadhyayam. You understand about your body's needs and longings, and you will be able to ascertain them and difference about each. So this is a very internal and individualistic experience which will help you go into the next level of subconscious understanding. Okay, again I'm deviating. So the same thing, the women are not able to do certain exercises today's life. Earlier, 50 years back, they didn't have to do any exercises because they had a lifestyle which included all the organs and all the limbs of the body were utilized physically, and they had a good rest. Imagine, we did not have electricity long back, 50, 60 years back. So we had a good sleep immediately after sunset. But now going to sleep has gone beyond the time of 9 or 10 or even 12, and sometimes where we have night shifts, or we are stuck with technology, looking into movies or looking into any other thing. So that's a very bad example first, where we deprive our body of the sleep and rest it very badly needs. Sometimes women are also forced to work night shifts in terms of being equal to the task men do, certainly, but we will definitely be facing the repercussions of doing that. So, this is where the femininity issues and all the other ways for women to come out in society has proved in some terms as negative for them. That doesn't mean they have to sit back at home. There are certain ways which you can help the women achieve their goals as well as lead a healthy life. We have to support the women, because women are the producers of next generation. So in any society, any living society, the member of the species which reproduces is given importance, because that is a basic instinct of a nature of a living being, that it has to reproduce and increase its own um, species. So if women are not healthy, we will not be able to produce the give again good next generation children to the society. Okay, next slide, ma. So what we see here is, let us differentiate the three phases of life. Ayurveda says for all people, any man or woman or child, we have three phases of life. That is Balya, Madhyama, and Vruddha. That is the young phase, the pre-adult phase, maybe till 16 or 17 years, or at the max 20 years of age, when a child is born and then it grows up to its adulthood. So there are a lot of growing mechanisms which happen during that stage, and the woman or the man becomes reproductively agile, and the growth is stopped, but the ability, the energy levels to go to the next working stage is more. So this kala is called as kapha kala, when the kapham is usually, because the kapham is the energy giver, kapham is the sthirata giver in the first stage of life. So kapha is predominant normally in the early stages of life. Then comes the Madhyamavastha, the middle age, which extends between anything between 16 to 50 or 60 years of life, the most productive and active phase of any man or woman, where Pitta is more, because Pitta helps a person being more energetic and performance increased, and the physical and mental faculties are at the best. Then goes the Vriddhavastha, where Vata becomes more predominant, the depreciation of the tissues start happening, and though we are working, the tissues will be slowly degenerating and we will be having a less productivity in life. So these are the three phases in life Ayurveda mentions. But let us correlate this to a woman's Madhyama phase. We are talking about a fertile woman when during the life phase where she can procreate. So that is anything between 16 to again 40 or 50. We may not take it to 60 because we are seeing early menopause these days too much. So it will be maximum 40 to 45 years of age when it is considered as the fertile phase for a woman. That means that she is capable of carrying and delivering a good, healthy fetus. Okay. So this is more important for a woman because she holds a dual responsibility when she is carrying, and when she is capable of becoming pregnant, she has to go through the monthly cycles, the monthly menstrual cycles, which indicates that the lady's reproductive organs are working normally. We have seen today's depiction of modern hormones which influence in this normal cycles for a woman, and we can correlate them to three phases in Ayurveda for a fertile woman. The three phases would be Rutu Kala, Rutumati Kala, and Rutuvyatita Kala. These are in those 30 days of one cycle to the next cycle. Rutu Kala will be the first fertile phase, where it starts between 12 to 16 days, which can be correlated to the follicular phase of the menstrual cycle, where you have the estrogen secretion is good in the from the ovaries. Okay, so this is when the lining of the uterus, the endometrium starts developing good, and it is gaining in size, so that it is the circulation to that part is good and it is very strong. So that developmental phase where a lot of sthiratva is needed, it is called the kapha kala even in the follicular phase. So rutu kala is that. Then comes the Rutu Vyatita Kala. After ovulation, after that, when the it is called the secretory phase, where progesterone hormones are more in the female body, and this is when the uterus is ready to receive the fertilized ovum if any conception happens at that time. So that is the secretory phase. Here it is mostly pitta is more because the blood circulation to the endometrium is good. There is hyperplasia of endometrium and it is all very robust. And once the fertilization happens, pittam and vatam have to be more so that the ovum, the fertilized egg starts developing into a fetus. Then Rutumati Kalam is the 3 or 5 days of menstrual phase when Vata is more, and because there is no fertilization happening, the endometrium is shed, and the uterus starts shedding out the endometrium and pushes it out, and Apana Vatam is the Vata which helps in sending this out in a proper term. Okay. So this three is the basic understanding of today's modern science and Ayurveda's correlation of the three phases of a menstrual cycle. Now, in which phase? Mostly women make mistakes in the Rutumati Kalam because we think those 3 or 5 days are when we are menstruating, when the women are menstruating is definitely not a very pleasant experience, at least for 90% of the women. And we know our body is tired, we know we want to take rest, but because of the social taboo and because of the peer pressure, we don't want to talk about it or discuss about it to many people. We have we have means of either suppressing the pain or forgetting that and diverting and doing our regular works in the normal manner. What was socially speaking? Let us talk about certain things which were happening in the early years, in the early days when a woman was having her periods. She was restricted to one area of the house. She was not allowed to take bath. She was given very simple food, not regular food. Nobody can touch her and nobody can talk to her. She was isolated for 3 to 5 days. After that, she had to take a full bath and then only she can get inside the house. So why? So that time, this had its relevance. But when due to changing social scenario, we all thought that it is why should women be kept taboo like that? Why should we not talk to the woman at that time? Why should she be treated like an untouchable at that time? So we all thought that we have to change that procedure, and so we broke those rules. Okay, we wanted comfort, good. We wanted to be accepted, good. But where has that led to? We have started becoming infertile, we have started having PCOD issues, we have started having more stress issues. So has it helped the woman as a woman in those ways? Okay, does it mean we have to go back and stay again alone or isolated? Forget about all the taboos and all that's happened or is happening. I'm sure most of the women can relate to this expression by what I'm going to tell now. Do you really feel like going out, or do you really feel like going out and talking to somebody when you are in pain during your periods? Honestly telling, when you do your swadhyayam and when you're able to be aware of your body's needs, most of the women can definitely relate that yes, I would like to be left alone. I would like to have no stress within me. Okay, I don't have any commitments to do. I am not responsible for any of the day-to-day activities of the family. I just need to rest, even some light food and rest. That rest helps in proper shedding of the endometrium and proper development of the next endometrium so that the uterus is ready for the next cycle. Imagine why we talk about stress levels in all the ages, in all the activities. So, this when you are forced to do normal activities, when your body is shedding the endometrium, that is also a stressful situation for the hormones and for the uterus. When you consider it in that way, you can easily see why people are facing so many issues. We think we can drive bikes, we can drive cycles, we can go anywhere, we do all the work, we climb stairs, we do all the physical work, cook, everything is being done. So what happens is we are the vata, apana vata, which has to really be focused on shedding the endometrium and make sure that the urine and bowel and all sorts of excretion happens normally so that the uterus is ready for next development. It is not able to concentrate. So the Apanavatam it has to travel in the reverse. So you feel the pain and the blood. Then imagine people doing a cycling exercise or going walking or jogging during periods. What happens is again the blood flow, which has to be concentrated towards the uterus area, is going to all the other areas of the body. So again, you have cramps and pains. The muscles which have to be really relaxed and remove all the water retention that was happening for the previous 20-25 days. It doesn't happen properly. So we are keeping it safe within the body so the pain starts happening even after the periods. And actually we have had incidents when women who are cycling or girls who cycle mostly using a sanitary napkin and then sitting on cycles and driving for a long time, the endometrial layers which has to be shedded goes back reverse and settles down, and everybody knows why endometriosis is so difficult to cure. So all these conditions, I don't know, we have not researched completely on this topic, but we have had instances where this is the main reason for endometriosis to happen in young girls because They don't want to feel isolated, but they are not mature enough to understand the needs of the body during that time. But seriously, some rest and simple food is needed during the menstrual phase, so that the vata helps in shedding of the proper endometrium, and then we are rejuvenated and ready. It is almost like detoxing of your body. During a detoxing, Ayurvedic professionals and today many of people do understand detoxing of the system throughout at least once or twice in a year is important to remove the excess of doshas from the body. Okay, so this doshas naturally happens every month for a woman. The excess Rakta dosham and Rakta dhatu is expelled outside. So we really need to give the woman a normal rest and a pleasant experience throughout that time. There are certain stories or certain facts which are being told in text of Ayurveda that okay, a woman who is during her periods after menstruation, immediately after the fourth or fifth day of the menstrual cycle, she has to have a nice abhyanga, take a bath, and first only look at her husband or look at a person who is pleasantly acquainted with her. Then she will have a normal cycle to have a normal baby in future. This may all sound very unnatural or sound may too spiritual or too unbelievable, and I'm sure researchers are not done in this angles, but we need not prove that right or wrong. But we all know heart of heart that the woman has to be kept pleasant and happy during her period, because she needs to rest so that she can go through the next 30 days of her normal life without any pain or suffering. There are certain instances where we start using cyclic tablets. This many women are doing due to lot of issues, where when you have irregular periods, we think that taking cycle tablets for 30 days, which are hormone tablets, in a synthetic hormone type, which make sure you have a normal cycle. But can you think it in the reverse side? In the From the internal angle of your body, your ovaries and your uterus responds to the hormone levels of your body, of your blood system. But the hormones have to be produced from the ovaries and your pituitary glands. What you do is you supply those hormones technically externally. So there is a artificial environment created inside the body which says that the hormone level is normal, but actually your organs which have to produce those hormones are not producing. So they lie dormant. For 5 months, 6 months, or 12 months, how long ever you take those cycle tablets, it remains dormant. So when is it going to start function normally? Even though you supply an external hormone, it cannot induce ovulation, because that is a anovulatory period that's going to happen there. Your egg is not released. This is when, and this I am not sure how far it is being practiced now. Many women who have spiritual functions which happen in the family, or some festivals or temple related festivals which happen in the family, they still feel bad that they are not able to participate in those functions because of their period. So they try to postpone it artificially with these tablets. Again, you are interfering with the natural secretion of hormones inside your system. Please avoid that. That is a very strong statement I would like to give, because anytime, even 1 month, once or twice, you start doing that, you are disrupting the natural phenomenon happening inside your body naturally. Please take that very seriously. This has led to many complications during your menopause or during your childbirth. So please avoid that. Any function is for us. So women have to remain healthy to participate in that function. If you're not able to participate, well and good, you can go and take rest. The family and the society has to learn that it is not a taboo for a woman to have her periods during a function, and they must stop talking something ill about that woman, because every woman has definitely heard remarks during that time. Oh, she's not available at this time. This is so bad. This is not good, not auspicious. These remarks have forced the woman to take these tablets and make sure she's able to do the chores during the ceremony or any function. Please, that is the reason these things have created a need. Any woman's cycle will happen normally if she is physically and emotionally happy. So if she has to be happy to have a normal next generation. This the society and the peer and the family has to understand that a menstruating woman needs all the care and all the rest. It is needed, and there is no need to give any snide remarks or comments during that time. As much as possible, she must be allowed to take rest. So we were discussing about Rutukala, Rutumati Kala, and the Rutu Kala. These are the three phases of a 30 days menstrual cycle for a Madhyama Vaya Stree. Next slide, ma. Okay. So what are the, I am not going through the expansion of all the details mentioned for a Rutumati. Whatever is possible in these times, I have taken only that. First, lying down in a mattress made of darba grass. That was mentioned in the earlier text. Okay, now why darba grass? Darba grass is supposed to be very cooling because a woman who is in a Rutumati Charya, who is in a menstruating phase, there is an increased metabolism. There is the Apanavata which is expelling out, detoxification is happening. So your body is tired. It needs all the coolness and all the comfort. So earlier, women used to sleep on ground. So darba grass, which is soft and which is cool, which has lot of positive energy, was mentioned in those texts. So whichever is cool for you, whichever is comfortable for you, but lie on a flat, normal surface. Any synthetic mattress, any mattress which has synthetic fiber in that will increase the temperature of your body. That was one of the reasons they told that don't sleep on a bed. It is not that the woman have to be made to sleep on the ground. Earlier, the sleeping was the floors were made of mud, so it was hard. It used to become very cold. So a mattress made of darba used to be given. But today we can use a mattress, but most probably and most suitably with a natural fiber in that, and which is made with cotton sheets. Please don't use synthetic sheets or satin sheets, which will definitely be hot unless you use an air conditioner. And again, air conditioner is a negative mechanism of the environment around you. So relax. It is not that you have to be sleeping all the time. Day sleep is again contraindicated in a menstruating woman. Resting, we always correlate to sleep. No, resting is different, sleeping is different. When you sleep in the daytime, your kapha will get to increase and it will block the vata in doing its duty to push the endometrium outside. So you can relax and do whatever you like to do so that your stress levels come down and you can have a very internal and external relaxed feeling. Then do and warm diet. Again, we are nothing cold. We think that okay, the body temperature is high, you feel hot, so take something very cold. No, again it will go against the kapam and vatam, so the vata will not be able to do its work in expelling the endometrium. So take warm food and the food which is easy to digest. So this kinds of food will help in, because digestion is again a task for the body. We all think, okay, we have to eat, so digestion is compulsory. Yes, digestion becomes compulsory when you start eating heavy food, and it is a work for your system. And don't give extra work. So, extra spicy food and too heavy food will change the concentration of your body to digestion rather than on helping in detoxing the system from your uterus. So, eat diet which is peaceful, which is satvika, quiet, and which helps in keeping your stomach without creating any issues. Again, resting, no activities. Physical activities have to be avoided as much as possible. You can walk around in your room, but no traveling or no driving and no excessive laughing or talking. All this will disrupt your psychosomatic energy levels. Honestly, if you try to practice this for 1 month, and you can see the difference in next 30 days during your cycle. You can see that you really feel refreshed, because those 3 to 5 days your body cannot take two loads of stress. Physically, it is facing a stress with the uterus, and again outside physically it cannot take another stress. Then wearing comfortable dressing. Wear loose cotton dresses so that it doesn't obstruct any kind of flow of vata and rakta inside the body. So wear loose cotton clothing, because your body is hot. You cannot wear warm clothing, which will again increase the sweating and trap. Okay. So these are all, though they are all mentioned in text, again I request the woman to introspect and really feel and understand that this is what is actually helping you. Please think on these terms, and then you will understand that these are practically relevant even today. We need not feel ashamed to mention or talk about our menstruating phase or periods, because this is part of every woman's life, let it be in India or any other country. A woman is a woman. So please understand what your system needs, what your body or mind is asking for at that time. Again, going to the some practices. Next slide, ma. Yes. What happens? Day sleep. Again, as I told you, when you want to sleep, if you sleep in the daytime, kapha vriddhi happens, the blockage of vata occurs, so the proper expulsion of the endometrium doesn't happen. Then oil application. Full body oil application and bath is definitely not suggested because it increases the heat. I would like to just deviate slightly in this topic. Again, I know Abhyanga has been mentioned by many people previously also. But again, we have to understand that there is a belief that, okay, Abhyangam will cause cooling in the body. And then when you take Abhyangam, your cold or your kapha increases. But honestly, even as practitioners and today's many public practitioners know this, I would like to add that Abhyangam is not cooling, it increases the heat in the body because Abhyangam is Vata Shamanam. So Vata Shamanam is again Ushna Karakam, and as it is during a Rutumati, you should not take Abhyangam during the phase of Rutumati. After the periods are over, you can apply oil on the body and then take a full bath. And Snana. Why? Then you are okay. Again, we will all wonder how can I be without taking bath for all 3 or 5 days? In Snana, we have to understand the literal meaning and today's practical meaning. Snana always means it is from head to toe, a good warm bath. That is what is a simple meaning of snana. So what they mentioned here is don't take a head bath because Shiras is the center for controlling or the energy transfer and the vata. If you pour water on your Shiras, again your the energy transfer is stopped and then the flow of vata, apana vata is stopped there. So snana, you can wash your body with lukewarm water for hygienic purposes and you can lead a clean life. But taking a head bath with oil application is not advised. That is the proper meaning here. When you simply any old lady says that okay, don't take bath, doesn't mean that you are not supposed to take bath. You can wash your body but not your head. Then again, pradhavana, running and exercises. Please don't do any exercises during this phase because again your vata tends to increase and the apana vata gets diverted. It goes in the opposite direction. It cannot expel the endometrial layer of the uterus properly. Then certain complications are bound to occur. Ati katana, lot of talking, and people who have talking as their profession need to avoid that. We think that okay, I'm only sitting and talking. Why should I worry? I'm not doing any work. No, I think Kathanam is also a work which takes some energy, so which creates some stress in the body. So any karma, ati yogam of it increases vatam, which I know all my fellow practitioners will be able to be with me on that. So ati kathanam has to be avoided and martha sevanam, unnecessary exposure to wind. That is why women were kept in isolated rooms so that they have no disturbance even from the environment. So no hot sun, no excess water exposure or no excess wind exposure also. So the internal and external system have to be balanced so that the full concentration is mainly on the uterus shedding its endometrium and getting ready for the next cycle. So that much of importance has been given for a woman's reproductive cycle so that the next generation can be a healthy progeny. So this kind of understanding is what we have to appreciate. So it is not tuning our body to the needs. We have to really respect the needs of our body and then live a healthy life. That priority of thinking is what today's society needs. Change in thinking and prioritization. Earlier, if we had a headache or if we had a mild fever, normally we take a pill and then we want to go back to our daily routine, do our regular work, and we thought that we were very strong because we were doing our work in spite of our body demanding rest. But now situation has changed that if we don't accept the demands of the body to take rest, if we don't realize that on the longer run, it is going to shut down. It is going to go into a breakdown where any amount of pills will not help you, and you will not be able to come back to your normal health. So that those are the lifestyle disorders which are facing, which are giving a lot of threat to today's people, and it is a huge wave of non-communicable lifestyle disorders which are affected, which people are being affected these days. I know everybody, I don't want to talk about the same things, but the awareness has to be more towards food and lifestyle. And we have the knowledge of what is good for us and what is not good for us, but we don't realize the importance of certain small issues like this. What is going to happen? It is only a simple thing. No. A simple thing of doing an oil abhyangam at least weekly once per day will prevent many neural conditions and many joint conditions. So these are the dinacharya which is mentioned very, very deeply in Ayurveda, and those are the gems of Swasthasya Swasthya Rakshanam, prevention care. So let us, we have that knowledge. We are the proprietors of that knowledge throughout the world. So we must be proud to start implementing them in our daily life and set an example for the world that we have a healthy society and we are ready for giving the healthy next generation to the world. We cannot afford to take care of unhealthy next generation because we'll also be old and we cannot be taking care of them. They have to be robust enough to take care of us. So that is how society works and that's how nature works. The older generation has to be taken care by the younger generation. But now everybody knows the situation is not like that. The younger generation are very, very slow and they are not able to physically take much of pressure. So all this, please think where we have gone wrong in creating a healthy and robust next society. So there comes the fertilized, the ovum which is secreted in the, which is produced in the lady's ovaries. That is the single half cell which is going to become a fetus. And the same thing goes for a man. Even for a man, he gives the next half of the half cell of the child. So if he is also not happy and the woman is also not happy or healthy, how will the child be healthy and happy in future? So that is where the fertility issues have started. We have so many spermatozoological issues also these days, so many morphologically improper sperms which are being produced for a man. Then same thing. So these are all we have to take care of them in the earlier stage now. Still now we can handle them easily. But if you are going to let it go too far, prioritizing on the other materialistic issues on our life, we are really going to be faced where babies will be made technically, not naturally, just like cows or cattle. Will it be so happy a situation where the total family life is going to be dependent on some technology? So that is not a very nice thing to be. Okay. So these are the concerns which we really have to address, and that is what I wanted to take in this. So I am giving certain advices. Next slide, ma. So which can be a take-home factors. Simple thing: during your menstruation, kindly ensure take rest. Anybody can manage to pass remarks, anybody can manage to comment on that, but please don't take it to your heart. Your body is and your responsibility. I tell this to every woman who is going through menstruation phase. Make sure you get adequate rest and you are able to lead a stress-free life and eat non-spicy and refreshing light food. You may have cravings. Those cravings will be psychological due to lot of imperfections in your dhatus. But if you go into the cravings, you will not be have a healthy menstrual cycle. So please take simple food. Once you start practicing this for at least 2 to 3 cycles, those cravings will go down. I can guarantee that. And sports activities and travel, please avoid. Enjoy the rest. There is nothing to feel guilty about it. And then this one important point, I want not only every woman, everybody to realize this that the natural urges, your Vega Dharanam, the 13 or 14 natural urges of the body should not be suppressed. The first and foremost being your urine and bowel movement, which we tend sleep, which we tend to suppress in today's life because we travel more. We are in the school. It starts from early school days. When the child goes to the school, the either the toilet is not clean or the toilet is not available, or it feels shy to ask the teacher for a rest break. It tends to suppress the urine urge and then suppress the urge to pass bowels. and that becomes a habit, and that is where the apana blockage starts. Right from that age of 5 to 6 or 7 from the school days, then that suppression is where apana vata starts increasing, and we start facing the issues of PCOD with girls who are even 70 to 18 these days, and that develops into an infertility later on. So the suppression of natural urges is very, very wrong. Again, this is also based on the peer pressure and the social taboo related with it. Excreting the waste material from your body is natural. There is nothing to feel guilty about it. And please don't feel shy to ask for a break or to pass those urine or motion whenever you have the urge. Make sure your lifestyle is in tune with this, and make sure your food habits are good so that you pass your bowels early in the morning as soon as you wake up. These are all the dinacharya which we have to practice. So you will see a difference in this when you start adopting step-by-step practices of whatever is healthy for the body. And again, sleep good, sleep in the night. If just by studying late in the night, you will not ensure good marks. You will never ensure a good healthy life. Night is meant for sleeping for our humans. We are not nocturnal animals. So please make sure you go to bed at least by 9 or 9:30. You can wake up even 4 in the morning and compensate those 2 hours and do the studying, whatever you want to do. That's a small note I would like to add. These two are very, very important. And avoid medications. I have seen girls or women who are working or studying to avoid the cramps or to overcome the cramps and pain they have taking pills. Again, I would say that those pains will make you aware of where you have gone wrong. So once you experience those cramps, you have to make sure next cycle you don't have those cramps. Not try to camouflage the pains by taking some pills. Make sure you don't get the cramps next month. So think on what has to be done for avoiding those cramps. The stopgap solution of taking a painkiller is not good because the muscle is not, the uterine muscles are not able to contract normally pain free and like shedding the endometrium. That is why you have the pain. Speaking in modern science terms. Well, as I in Ayurvedic terms, I would say Apanavata is not in the normal flow, so it is giving you pains. So what we have to do to avoid that situation? So think on those terms and make sure that you don't get cramps next month. Because if you stop, take the painkiller, the muscle contraction will not happen. The shedding of endometrium will not be proper and complete. The bleeding will stop. So the endometrium remains inside. Then again, for the next cycle to start healthily, for a new endometrium layer to happen, it does not happen healthily. Again, that is another waste cycle because your womb is not healthy, your uterine layer is not healthy. Then you have spontaneous abortions. If there is any conception at that time, the child is not able to get. You have IUGR, growth retardation. You don't have normal endometrium, which is going to help the baby to develop, and then you have spontaneous abortions very easily. I There is a lot of data in that also. If needed, we can collect and say, but it will be too much of an information right now. I am trying. I'm not here to make people afraid of the situation, but honestly telling, this situation is as hard as it's going to get. Please be aware that your menstruation phase, taking care of yourself, is the basic first step towards having a healthy reproductive life. Young girls, anything above 16 years, please make sure you start working towards a happy and healthy life, mind and body, both the ways. I hope I have given some takeaway points for women and the family members and the peer who have women in your life. Please understand the gravity of the situation and make sure everybody cooperate in women having a healthy and normal menstrual cycle. Thank you. We're open for questions now.
Thank you, ma'am.
Thank you.
Now we can switch on to the question and answer session, ma'am.
Yes.
Ma'am, I have a doubt.
Yes.
Ma'am, what's your opinion on yoga during menstruation?
No. Yoga, you can, resting is more needed. Yoga is not needed even during menstruation. Yoga is also, again, it helps in the pathway of vata to circulate inside the body. But during menstruation, your body has to concentrate only on the apana vata, not the other vata. So you can always take rest. You can do normal your chores inside the house, your own personal chores. That is enough of a yoga because it is a very serious detoxification that's happening. You don't have to do any yoga.
Ma'am, people nowadays are using menstruation as a contraceptive method. Like they
Yeah.
are using that. So, what's your opinion on that?
No, it is not advisable to have sexual intercourse during menstruation because sexual intercourse itself is a very physically demanding act where vata tends to get increased. So, and it is an excretion which is happening through the vaginal canal. So, you cannot block that canal just for the sake of pleasure. And it is not pleasure, actually, it is a we want to try something new. That is the attitude which is actually pushing them to try this. But it is not healthy, it is very unnatural. So this, I would really not suggest that anybody have sexual intercourse during menstruation. It is not advisable naturally and for healthy reasons.
Ma'am, what do you think about menstrual cups? Usage of menstrual cups? Is it
Yeah,
recommended?
menstrual cups. As long as you know how to use them properly and empty them in the right time. See, tampons also were considered very, very comfortable because it is internal and easy to use. But again, see, when there is a shedding happening, it is not only blood that's coming out, it is layers of tissues which is coming out. And when there is a tampon inside, the tissues, they are very, very sensitive and they can react. And the cotton fiber, if it is not a good material, it will irritate your vaginal canal. And sometimes, if you don't change it in the right time, the endometrium tissue, due to the contraction of the muscles, it can go inside back and go to the ovaries or other areas of the uterus. So that is when endometriosis again happens. So tampons also, practically speaking, I wouldn't say it is the right method. Menstrual cups are better, but you have to make sure you empty them in the right time. So using of normal natural methods is better as long as you don't obstruct the pathway. The pathway is a natural pathway. You can keep anything external, but nothing. Don't disturb the channels inside. So the menstrual pads, the hygiene pads which we use now can also be as natural as possible rather than sticking to the terms like it has to be dry and woven and we don't feel wet. This space is meant to feel wet. So it doesn't mean that we have to feel wet, but we can use natural techniques to use them. So that is why do we don't want to feel wet? Because we want to do our regular work. When we are resting, we can feel when we can always go and change the pads. And it is not a problem at all because you're resting. Anytime you can go and be natural about it. But when you are with other people, you don't want to do that because you feel that taboo. That inhibition is what is wrong now. I want women and the society to break that. It is not needed. It is something normal. That is why women were isolated those days. It is not an old age practice. It was a very sensible practice to allow them to rest at that time. But we have changed that way, telling that no, no, women are treated as untouchables. No, that was a twisted fact. It is a myth. It is not like that. Even now, I'm sure 90% of women, with heart of hearts, they'll feel that okay, let me alone at least these 3 days here. Let me take rest. But they don't want to express it because they don't want to be left out in the race of being a very modern and successful woman these days. We have to be a woman first to be a successful woman. You need to be a healthy woman to be a successful woman. You cannot suffer internally and project that you are successful outside. That's not how life works.
What do you think about usage of Ashoka during menstruation? Ashoka and its usage during
Yes.
menstruation.
Ashoka, any medicines, if you have a problem and if you know you have started a problem, okay, during my proliferative phase or my secretary phase, I have led a very increased travel life and I have not been able to rest normally or I have been having constipated bowels. You know your Apanavata is not normal. You can take the help of these natural herbs to have a normal menstruation. So Ashoka is not bad in those terms and it will help in reducing the cramps. If you may not start them even during menstruation, you can start them even pre-menstruation also, it will help. So we know the benefits of Ashoka. It is a wonderful uterine tonic. So it has to be used judicially. We have to understand why it is used and how it has to be used because it is again people specific. Everybody cannot take Ashoka and say that they are normal. No, why it has to be used, we have to understand.
Thank you for the wonderful session, ma'am. Thank you for educating and enhancing our mind through
My
your
pleasure.
thoughts.
My
Um,
pleasure.
we are eagerly waiting for another session of yours, ma'am.
Definitely, will be. There is a lot more to talk about today's the practices and why we can where we can change. I would be happy to share whatever experiences I have in this field. Thank you for this opportunity, and I sincerely expect at least some of the women take this advice and change and lead a very happy and healthy life. Thank you.
Thank you so much, ma'am.
Thank you.